Okay, so in general, actually feeding of puppies is probably the most important part in the life of an animal, is the first 12 to 18 months of their life in terms of nutrition, because it actually can determine a lot of things afterwards. So developmental problems and things like that are actually sort of the base or the foundation gets laid during a puppy time, because it's not like in humans, it's puppies grow a lot faster, so the development that they go through is a lot quicker than we do. So that means that the nutritional factors that they have to get in the first, specifically the first 6 to 12 months, are really important to actually fulfill what they need to get to the point where they have their adult weight and their adult height and all of that. And it's also even more important in the large breed puppies, because obviously they have a lot more growing to do than the small little guys. So in general, I always say, like, if you just want to do one thing right by raising a puppy, get him or her proper puppy food. And it doesn't have to be the most expensive puppy food, but it's important to get a food that is specifically made for puppies. And if you have a large breed puppy, get a food that is specifically made for large breed puppies, because there's a big difference in feeding large breeds in comparison to small breed puppies, just in terms of what we need to feed. There's 3 key factors or key nutritional factors that we really they're really important, that needs to be balanced really well. The one is protein. So they need a lot more protein, puppies, than adult dogs. It's for 2 reasons. The one is that their energy levels are a lot higher in terms of, obviously they need energy to grow and to move, and also they need the amino acids that they get with the protein to build lean muscle. So that's the protein part. Then we need fat. So it's actually important that there's a certain fat content in the puppy food, for the one reason, because it's a really nice also energy source, but to the other side, it's also it helps to digest and absorb soluble fat soluble vitamins. Otherwise they can't take them up into the system. And then the third one, and that's where now the difference comes in between large breed and small breed puppies, is the calcium, and specifically the calcium phosphorus balance, because they need a lot of calcium obviously for their bone structure, but it can't be too much, because then it sort of negatively influences the bone development as well. So that's sort of the 3 things, and that is something that's really important. And the nice thing about the puppy, most of the puppy foods that we know of, is that they actually have done a lot of research, and they know exactly how much needs to be in of what and for what breed, in terms of large or small breed.
Okay.
So see, that's exactly where the sort of nutritional key factors come in. So meat only is protein and a certain amount of fat, but it lacks most of the calcium and most of the phosphorus, as well as other minerals and vitamins. So the dogs officially fall under the group of canines, but that's more because of because they have their canines in terms of teeth development, but they're actually more omnivores than they are canines. So they need all the other, they need fiber, they need carbohydrates, they need other things for like energy, vitamins and minerals. So only feeding them meat is unfortunately not enough.
Not a good times a day.
So puppies, their metabolism is really quick. So feeding them only once a day is not enough, and it's also that depends on the puppy, but they shouldn't take the amount that they need to bring them over the 24 hours. If you only feed them once, they basically can't actually eat enough for it to last the whole of 24 hours. So they say, well, I usually work it. I know it's difficult depending on where you are. So on 8 weeks, you can, anything before 8 weeks, you should actually feed them 4 times a day, which in most environments is not really possible, because there's not everyone is at home 24 hours and can feed them 4 times a day. But if you can, up to 6 months, 3 times a day is the ideal, to feed them 3 meals a day, and then at the age of 6 months they can go to twice a day.
Good.
So that all depends on the puppy, the breed, the age, and the weight. So there's certain factors that come into consideration, and then it also depends on the food the brand that you choose. So I've just chose two of our main brands. The one is Royal Canin, the other one is Hills, for the pure reason that this is the feeding instructions is completely different, so it makes it difficult sometimes that people don't know really what to feed and how much to feed. But every food bag, it doesn't matter what brand it is, at the back they have a table, and on the table it explains exactly how much to feed, depending on, and now this is where the difference comes in with these two bags. Royal Canin goes according to adult weight at the end of the day, whereas Hills goes according to the puppy weight that they've got at that stage. So with Royal Canin, this is now specifically for Yorkies, so it's obviously the weight is relatively low, but it goes according, so if you have a small breed or you have a teacup, then you're obviously closer to 2 kilograms. If you have a normal size, you'll be closer to 4. And then they have every month they change the amount that they need to give, and then the amount that you get here is the amount that they get a day. So it's the amount they don't give you per feed, they give you 24, so for one day what they need. And then obviously depending on how often you feed them, if you feed them 3 times, you divide it by 3. If you feed them 4 times, you can divide it by 4, and so on.
Okay.
And then obviously you have to, with the age, you adjust. There's always a range, because in puppies, activity also plays a big role. So you get the lazy puppies and you get the hyperactive puppies. So you're gonna sort of have to, not only you say like, oh, it says 150 grams, that's all I'm giving. So if you see that your puppy is really active and it sort of looks really skinny by feeding what they're supposed to get, you obviously have to adjust it a little bit by just upping their food. And this one, if you look at, I don't know if you can zoom in there, but this basically goes according to puppy weight, and then according to, it doesn't go every month, it goes like less than 4 months, between 4 and 9 months, and then between 10 and 12 months. So it changes depending on how old they are.
Okay.
So I'm always careful to make comments, because I do feel everyone is allowed to make their own decisions in terms of what they want to eat. And if you ask me, can dogs live vegan? The answer is probably it depends. So it's not a clear no. So as long as you make sure that they get the part of protein, the part of fat, and the part of amino acids in calcium that they need, you could possibly feed a dog vegan. The problem is, and that's later on maybe not as much as it is really as puppy, that it's really, really difficult to get the balance right. Mm-hmm. So I wouldn't want to, like, I don't know if there's like who I would trust to work that out for me to feed my puppy just on a vegan base and make sure that it actually gets in the same amount of protein as it should, the same amount of fat, the same amount of vitamins and calcium in terms of balance with the phosphorus. So I think it's really difficult to get that one right. And yeah, I don't think I would want to go that route. And it's also, there's a lot of like, and I mean, the people that are vegan, I probably would know, but they have to supplement themselves with a lot of vitamins and minerals that they don't get just by eating the plant-based food that they usually eat. And it's the same in dogs. So it makes it difficult. So it doesn't help to just say, I don't want to feed my dog meat. I want to feed him vegan, but I'm just going to give him whatever vegetables and leave it on that. So if you want to do it, I'm not saying you can't, but do your research and make sure that you supplement it enough as it should be. So it can. So they say, I think in humans they know, they've done a lot. I think it's a lot more difficult in dogs to do that research, but I think in humans they've done enough research to know that the quality of food really does play a role in terms of mood, behavior, things like that. So they know, for example, that Tryptophan, which is one of the really important amino acids, is part of protein, and that gets changed over to serotonin in the gut by the bacteria, and then it obviously gets absorbed and it goes into the system. And the serotonin is what they call the happy hormone, so it does have an effect on obviously mood, which is, as I said, a little bit more difficult to determine in a dog than it is in a human to say there's a good mood or a bad mood. But I do feel that if the quality of the food, and with that obviously the hormonal influence that it does have, can definitely have an effect on behavior at the end of the day. Yes.
Okay.
Okay, so there's a lot of different worms that we've got actually. So with puppies, our two main parasites or worms that we're worried about is hook and roundworm. It's also the ones that, and why we're worried about them, because it's the ones that they can actually get in the uterus already, so it's in the womb, as well as by feeding from the mom. So it's always, people say you've got to deworm your puppies from really young of age. You actually have to deworm the mom before the puppies get born, just to make sure, because they can actually get it while they're still intrauterine. So worms, as I said, it's the roundworms and the hookworms that we see the most in puppies. They're small and long, so there's different sizes.
I'm sorry to just quiet this down. Sorry about that.
No. And they have different stages. So I think it's easier to have a look at that. There's a life cycle, with the roundworm life cycle. So I don't know if you can zoom in there. Okay, sorry. So the adult worms live in the gastrointestinal tract of the dog, so in the intestines, and then they obviously lay eggs, and then the eggs get either way transmitted to the puppy directly through in the uterus or through the milk, or obviously it comes out at the other end. And then these eggs tend to move over to a larvae stage, which then can either be eaten by rodents or other animals that get eaten by the dog, or directly ingested orally again by the dog. So if there is worm eggs lying around, they are going to get eventually into the dog. We also need to remember that if the female dogs, specifically with their puppies, they do clean them and they eat everything that comes out at the end as well. So it's basically a vicious circle, so they never actually get rid of it. So this is the main worms that we do see. So it's really important, as I said, to deworm before the mother gives birth, and then we usually deworm from 2 weeks of age, every 2 weeks, until they're about 8 weeks old, and then after they're weaned once a month. The big thing about deworming, and I think that's a lot of people don't really know, is that it's not like the tick and flea treatment, that it is preventative. It is actually, you treat what's there, but it doesn't mean that they can't pick it up the next day. So it's not a preventive measurement. It's really just a treatment of what is there at the moment. That's why it's so important as well, if you have more than one animal, deworm the whole lot at the same time. So in terms of symptoms, and it all depends on how many worms they have. It can actually get quite severe, especially in little puppies. So worms are mainly blood suckers, so they attach to the intestinal walls. That's where the bloody diarrhea and those kind of symptoms come from. And they obviously take a lot of the nutritional factors that the puppy is supposed to get in, they take it away. So a lot of times you get these puppies that have almost like a boob bends, there's a lot of, obviously, they have a dull coat, they're just non-thrivers. There's a lot of times puppies that actually just have parasites that we need to get rid of. So that's the round, and the hookworm works pretty much the same. The hookworm is just a lot more difficult to treat. It's not as roundworms, one deworming, they're gone. The hookworm is usually a course of about 2 weeks to actually get rid of it completely. So they're a lot more resistant. And then the other one that a lot of people always talk about is the tapeworm. Tapeworm is something that we also see in puppies, but not as much, for the pure reason that tapeworm comes always with fleas. So one of the big carriers of tapeworm, or the main one, is the flea itself. Oh. So if we've got dogs that are riddled in fleas, you can know they have tapeworm as well. So if you pick up that your dog has tapeworm, deflea at the same time, because there is a pretty good chance that there's fleas around, even though you don't know about it. So one of the main hosts is the flea. And
so those are those long worms?
Those are the little ones with the segments. The roundworms are the long ones, and the tapeworm is the one. A lot of times you see them, it almost looks like you think there's little worm eggs, but it's actually not. It's the segments of the worm. So the normal worm eggs that you would see, that we can test for roundworms and hookworms, is something that you can only see microscopically. You're not going to see them just like that coming out of the poo.
Okay.
And then there's a couple of other worms that luckily we don't get them here. So we get Spirocerca, which is a parasite that they get in Gauteng. They have as a main host the Adidas.
Adidas?
And because they carry them, but it's actually the beetle that is the one that it develops in, the dung beetle, and it makes tumors in the esophagus.
Okay.
So it has it's a different kind of, but they're really bad, because a lot of times you can't pick them up early enough, and you only pick them up when it's basically almost too late, because it's already made the tumors in the esophagus and all the symptoms of that. So it's the one that they get up here, which we don't get here, which is nice.
That's good.
And then you get heartworm, which is obviously, the name says this, it's a worm that likes the heart, so it goes into the heart, but that's something that we basically don't get in South Africa at all.
So is that
So it depends a little bit on how much it ate, and if you want to play it safe, the first thing would be to take him to a vet. If you're far away and you can't, because there is obviously people that live on a farm, and a lot of times it happens there, the main thing is try to get him to vomit it up. So that's something that is really important, that with any toxin, if they don't vomit by themselves, so you see they've eaten something, to get rid of it, most of it, before it actually digests and absorbs, is probably one of your most important things to do. If they come here, if you can bring them to a vet, we've got medication that we can inject, so that it makes them nauseous and they vomit. If you're not here, you can use soap.
Soap?
Yes.
That's interesting. So you can feed him Lux?
Well, not, but that's a bit more difficult. So what really works well is if you use washing powder and you use a little bit of water and you make it in a little bowl.
Oh.
Because it immediately causes them to gag, and then they'll vomit.
Sticking your throat down, or your finger down the throat?
Yes, like we would put a tablet down the throat. Okay. Yes, a small little bowl. It doesn't obviously have to be a big one. Small enough, they are going to vomit it up, and that just get rid of everything that's in the stomach. That only works if it happens about an hour after the digestion. So it doesn't help if you know, or if you think it's eaten it 3-4 hours ago. It's not going to make a difference anymore in terms of to get rid of it. So then it will already have passed the stomach, and that's the only time when you can actually get rid of it. So that's the first thing. If you're early enough, try to get rid of as much as possible that's still there. Then people always love charcoal tablets, but it does help, definitely. Activated charcoal. So it helps to bind whatever is still left in the gastrointestinal tract. The problem is that depending on what they eat, it might not be enough. So once it's absorbed into the bloodstream, nothing orally is going to get there anymore. So then, depending on what it was, it obviously, most of them, if we know it is what it was and it's toxic, they go on a trip just to flush the system and to get rid of it. And then depending on if it is something that we can actually antidote, so if there's something that we can use against it, then obviously we try to do that. But a lot of times the people come here and say, my dog is not well, or I'm not sure what it ate, and where you're gonna, then you can't just inject an antidote if you don't know what they actually ingested. So then it's more symptomatic and supportive treatment really than anything else. But the drip is something that helps.
What are the symptoms when the dog is poisoned or a puppy?
Well, it depends on what it is. It depends on how much they got in. Okay. So there is the sneaky toxins like rat poison, for example. If they don't eat a lot, there's no symptom at all up until they start bleeding. 7 days later. So it's something that you're not gonna necessarily know. But most, if they eat enough of something that's really not well, then that, depending on what kind of toxin it is, but a lot of times they start vomiting and they're nauseous by itself. So it's gastrointestinal symptoms, might have diarrhea. They can have neurological symptoms, so they can sort of be almost like they're off balance. They might walk into things, they might all of a sudden be really lethargic. Then it's something that will definitely need attention and rather now than later.
So that must be prevented at all costs.
Yes, if you can prevent that, and the problem is with puppies, they chew on everything and they try everything. Yeah. So older dogs are sometimes a lot cleverer than that because they know sort of what not to chew, but a puppy, it's like a child that puts everything in the mouth. Talking about toxic things, just have one picture in terms of if we talk about giving dog foods off the table. So this is really the big no-nos. If you want to feed your dog something off the table, which you shouldn't do in the first place, but I don't think people really know that these things are quite severely toxic for dogs. So avocado, there's a lot of people that tell me, but my dog eats avocado every day because I have a tree in my garden and the avos fall and they eat. Yes, it's not the meat, it's the pit.
Oh really? Okay.
Yes, so it's the pit that has the toxins in. So and touch wood, most of the dogs don't eat the pit, so they eat around the pit. So but obviously you should, if you can, avoid them eating it, just because it's a poisonous part. Then, alcohol and caffeine is sort of like a given. Chocolate, most of the people know.
Yeah.
Something that not a lot of people know is xylitol.
That's deadly, apparently.
Yes, very, very toxic. So I've had more than once that the dog came in with seizures, and then they say, but we don't know what happened, but it comes out at the end of the day, the dog just every morning has a sip of the dad's coffee, and the dad drinks the coffee with sweetener, xylitol.
Xylitol, okay.
Yeah, so that's really something. Then garlic and onions is something, it obviously is dose dependent. So if there's a little piece of garlic or onion that falls on the floor and they eat it, probably nothing is going to happen, but it can cause anemia, which is basically a low red blood cell count.
Okay.
Macadamia nuts.
I'm glad I'm not a dog.
Yeah, it's also something that you shouldn't do. And then apricots, cherry, and peaches is actually the pits. So it's the same as the avo. So it's not the actual fruit; it's more the pits that's in it.
Okay.
And then bulk grape and raisin. I think most of the people know that it's nephrotoxic. So it can affect the kidneys depending on how much they eat.
Okay.
Yeah. So I've got a nice picture because I think there's a lot of people actually that don't know what is the pancreas. So this is just basically to show this is how sort of like in very plain this intestinal tract of a dog looks like in all the organs that are involved in the digestion. So obviously it's mouth going down, and then that's the stomach, and then one of our main glands that we need to digest is the gallbladder. It's the same as in humans. And then we've got a very nice organ that's right next to the stomach. It actually is connected to the first little part of the intestines, and that's the pancreas. Now, the pancreas has two main functions. The first function is the digestion of food. So it produces a lot of enzymes to digest food. And the second function is it produces insulin. So dogs with diabetes usually have a problem with their pancreas, which is now not related to the pancreatitis, but it comes as one. So there is dogs with pancreatitis that shows diabetes at the same time, just as consequent that the pancreas is inflamed. So this is the little organ that we're going to talk about in terms of pancreatitis. Now, pancreatitis is the inflammation of the pancreas. So a lot of people think pancreatitis, it's an infection, so it's bacteria go up and then affect the pancreas. It's not. It's inflammation. Now, the big problem with our organs, if they're inflamed, it's not a muscle. So it's not, you can't drink anti-inflammatories and think the inflammation is just going to go away. Unfortunately, that would be very easy, but it doesn't happen like that. So it's inflammation of the pancreas that the only way to treat it is to try rest the pancreas. So that means that you take the pressure off the pancreas and you make the blood support higher. How does pancreatitis happen? Maybe we saw there. They actually don't know. There is breeds that are predisposed. So schnauzers, for example, they in general have their levels of blood fats are higher than in other dogs. It's just something that it's a breed thing. So they tend to be more prone to pancreatitis than other dogs, but it doesn't mean that other dogs can't get it. We tend to see pancreatitis more frequently in dogs older than 5, which doesn't mean that younger dogs can't get it, but that's sort of, I think it's just as the pancreas gets older, it gets more sensitive. And then we always say pancreas is a holiday disease because it can actually, let's put it like that, a healthy pancreas is not so much just get inflamed and you don't so much get just a pancreatitis. So that's not how it works. But a pancreas that is a little bit older and maybe over the years already a little bit sensitized is more prone to get irritated by fat. So fatty food, if it is the little bit of biltong or drogas that you give on the sideline, I'm calling it holiday disease because it's that Christmas braais, the Christmas evenings where you feed, but the dog also needs a present, or it's also part of the family, when they actually get extra fatty food that can push the pancreas over the edge. And then it gets inflamed, and then what happens if the pancreas is inflamed? It overproduces enzymes. And the problem is that the enzyme, there's just as many enzymes that can go through the duct into the intestinal tract where it should be. So it basically causes to almost start digesting itself in its environment, and that's why pancreatitis is so severe. So it causes, obviously, except for the fact that it causes an inflammation of itself, it causes inflammation of the gastrointestinal tract, especially the first part of the intestines where it's sort of lying right next to, which causes all the symptoms that we see, the diarrhea and the vomiting. It causes inflammation of the stomach because it's lying right next to the stomach as well. So it can cause gastric ulcers, and it causes inflammation of the liver. So with all that, it really makes it a horrible thing to have because it's incredibly painful. So they're really, really sore. Well, obviously because everything is inflamed, and they usually vomit, they have bloody diarrhea, they dehydrate relatively quickly, they don't want to eat, and they're really lethargic.
And there's no cure for it either.
No, so that's where the problem comes in, that once a dog has had a pancreatitis once, they're quite prone to get it again. And the treatment is, there's not a specific, as I said, it's not a muscle, so we can't give anti-inflammatories and it's just going to go away. So it's a quite complex treatment, and you have to wait for the pancreas to calm down by itself. So you support the system and you give little amounts of food at a time just to bind the enzymes that are there, and you put them on fluids so that they don't dehydrate, and you give them, something for nausea, something for pain. But there's nothing that you can give specifically to stop the pancreas being inflamed. So it's time, and it takes 7 to 10 days for a properly inflamed pancreas to actually calm down again, and then afterwards there is always a chance that it will flare up again.
So it's a change in lifestyle and feeding and
yes.
everything.
So they will have to go onto a low-fat diet chronically, and nothing on top of that. So and even the dogs that are on a low-fat diet, they still tend to have the flare-ups, unfortunately. Yeah. So
sure, that's bad.